We're going to talk about the importance of a complete eye exam before when evaluating a patient for blepharoplasty. Now, we've already put a drop of numbing medicine in Jackie's eyes. We're going to take a little strip of paper and test. It's called a Schirmer tear test. And you should, if you're interested in getting a blepharoplasty, if you're thinking about it, you should get this test beforehand, because this will evaluate you and tell us if your eyes are dry or not. And sometimes there's unsuspected people who have dry eyes that shouldn't be getting eyelid surgery at all. So let me show you how this works. Take a little bit of this paper, and she already has numbing medicine in her eye, and just lay it in here. That's on one side, and we'll do it once on the other side.
I like it.
Okay. Just look straight ahead. And basically, we're just going to wait 5 minutes. Okay, another thing we do is we evaluate the corneal surface. And the way we do that is, I'm going to put a drop of what's called fluorescein dye on the cornea. And then we're going to look at that with special lighting to see if there's any, to make sure that the corneal surface is completely healthy. Because people who have dry eyes may not even realize it. As a matter of fact, yesterday, I had 2 patients and didn't realize they didn't have any symptoms at all. But when we did these tests, it showed that they did have dry eyes, and there was objective evidence of that, and we had to alter our plan. Sometimes we cancel the surgery. In these cases, we just will make sure that we leave some certain muscles involved so they can blink and be more conservative with our surgery, so the person we won't make a dry eye worse. Okay, so this is how you do this. Take a little bit as a drop. It's just a drop. One drop each side. Okay. Now, we put a special light on here, it's a blue light, and that dye will light up certain spots in the cornea. Now, in Jackie's case, look up to the ceiling. Okay, that looks perfect. Okay, this machine is called a slit lamp again, and it allows us to evaluate the eyes in different ways. As a matter of fact, we sometimes take the pressure for glaucoma with this machine, and we can check the pressure in the eye. So it's important to have a complete eye exam before eyelid surgery to make sure that everything is going to work out okay. One other thing that I use this for is to evaluate the patient when they come back at 1 week. All the stitches are still in place. Because what I found is, by looking at the wound under magnification, you can see when sometimes the wound's not exactly red. Everybody's different in their healing, right? Sometimes the wound's not exactly ready. So when we think at about a week we want to take the stitches out, sometimes I'll have the patient come back about a few days later to allow more healing to take place. So this machine allows me to look at it under high magnification and evaluate how the wound is healing. This is a punctum plug. This is the delivery mechanism. When I squeeze this, there's a plunger that comes up and it pushes a little bit of hydrogel implant. It's sort of like a little speck of hair gel, clear hair gel, and it just sits in the puncta down here, and it makes whatever tears that she normally makes more available to her. So it really works well for dry eyes. It works almost immediately, and it's very good for preventing any problems during the period of time after eyelid surgery where you might be blinking instead of 20 times a minute, maybe 15 times a minute. So it really takes a person through and makes them more comfortable. Okay, in summary, by using this Schirmer tear test as a good indication about the dryness or the wetness of the eye, the adequacy of the tears, as well as this fluorescein dye, in conjunction with the use of this slit lamp examination, this slit lamp machine, it will allow us to completely evaluate the surface of the cornea and make sure that we're doing surgery on the right people. And certain people will be ruled out by this. It's not going to be safe for them to do it. So this is an examination, should really, we're trying to do this on every patient, so we can kind of make sure problems don't happen in advance. That's what we're trying to do.